crew.
Hello and welcome to Health Matters on Channels Television. Thank you for joining us on this episode. I am Mary Alale Yusuf. There are several ailments of the digestive system, peptic ulcer among them. Peptic ulcer is a disease of chronic development which results in injury to the lining of the digestive tract. It's a common disease globally, and some of its complications have been major causes of morbidity and mortality until the late 20th century. The condition generally occurs in people roughly between the ages of 20 and 70. My guest to treat matters about peptic ulcer today is Dr. Ganiat Oyeleke, a consultant in the Department of Gastroenterology and Hepatology at the Lagos University Teaching Hospital, Idiaba. She's also a member of the Society of Gastroenterology and Hepatology in Nigeria and the American College of Gastroenterology. You're welcome to the show, Doctor.
Thank you very much, Mary.
Okay, it's chronic, it affects the lining of the digestive tract, but what really causes it?
Thank you, Mary. Peptic ulcer disease is, we say someone has peptic ulcer when there is a break in the lining of the innermost parts of the intestine and the stomach. Peptic ulcer can be divided into the stomach ulcer, which we call gastric ulcer, and the small intestinal ulcer, which is called the duodenal ulcer. Now, what are the causes? For us in Nigeria, the topmost cause for us is a bacterium that we call Helicobacter pylori. Helicobacter pylori is usually transmitted from contaminated food, particularly fresh fruits, fresh greens or vegetables that has not been properly washed due to contamination from either fecal matters or dirt and filth all around. So that is one cause for us in Africa and in Nigeria. Another cause is medications. There's certain medications that we use that actually could lead to peptic ulcer. And this includes drugs. We group them under a top heading that is called the non-steroidal anti-inflammatory drugs. Okay. And that includes aspirin, ibuprofen, cataflam, all the kinds of pain.
The doctors always ask you, before giving you those medicines, have you had an ulcer before?
Yes.
Okay.
So that is one cause. There are other groups of drugs that we call the steroids. If one is using steroids for a long period, that can also actually result into...
Steroids, is it like what they ban people for using?
Yeah, well, not just the banned ones, but there are some other ones like regular prednisolone.
Okay.
If it's being used at a high dosage for so long, can result into ulcers.
Legal drugs, anyway.
Yeah, they're legal drugs, not illegal ones. Other things could be certain rare conditions, like there's a condition where the stomach secretes excessive acid. We call that Zolliger-Ellison syndrome. These are things that can result into ulcers. There are times when somebody has protracted illness or severe burns, or it's been in hospital for long, either ICU or some other chronic conditions that can result into ulcers. That kind of ulcer is called the stress ulcers.
So there are stress ulcers?
Yes, we call those ones stress ulcers. They're also referred in medical terms as Cushing's ulcers. So these are, briefly, things that can cause ulcers.
We always thought it was because of not eating properly, not eating enough. Does that also contribute?
Yeah, that may be a contributing factor, but that on its own is not a cause. Duodenal ulcers, for example, can be aggravated by lack of food in the stomach. So that is like a predisposition.
All right. So the ulcer is already there.
Yes.
Or it's about to come.
Yes.
And what the not eating does is it just helps it along.
Exactly.
But it's not the cause.
It's not really the cause, yes.
What about spicy food?
Spicy food for the same reason. Spicy food for some people would precipitates an ulcer from occurring. So if you have someone that already has been using maybe these drugs that I talked to you about, ibuprofen or long-term use of aspirin, and there's now So these will be like a background, and sometimes spicy meals can just precipitate that and result into pain and discomfort. What we tell people is identify things that could be precipitants for you and avoid them. So the spicy meals are on its own would not be responsible for the ulcer, but they can actually precipitate and aggravate the symptoms.
So we can eat our pepper?
Surely, if you don't have ulcers, so why not?
Oh, okay. So these ulcers, you spoke about some that are in the stomach,
yes.
Some are in the duodenum.
Yes.
Do they behave differently? What are the symptoms like?
The symptoms essentially are the same, and the symptoms will they usually have abdominal pain. The abdominal pain will be usually pain the upper part of the navel, the belly button. So we say upper abdominal pain. For gastric ulcers, the pain tends to be upper to the left side.
Okay.
Sometimes, but sometimes it's difficult to actually differentiate. But for most of them, for all of them, they have upper abdominal pain. Some will have bloating feeling, sometimes feeling like they're going to puke, that's nausea. Sometimes they have even vomiting, they actually vomit as well. And for some people, when there are complications, there are other symptoms that we see. Symptoms like weight loss, passing blood in stools, or dark colored stools. So those are things that will readily make someone complain that, oh, I've been having, but typically the symptom that is most prominent is the abdominal pain.
Okay, now these pains, stomach aches are kind of common to a lot of things. Would you be able to diagnose on the strength of the symptoms that somebody has a peptic ulcer?
Okay, so abdominal pain occurs in peptic ulcer, but it also occurs in so many other conditions. So it is usually very difficult to come out and say, you know what, the pain you're having is from ulcer. So it is also advisable to have other investigations done to confirm. Since we know, like I said, in Nigeria, the commonest cause is the bug that is called the H.
pylori.
Yeah, the H. pylori, Helicobacter pylori. So the first step would be, do the test. You can do the test for that. You can do the best of it, which is called the urea breath test, or you do the stool test for H. pylori.
Urea breath test?
Yes.
Is that like a breathalyzer? You just breathe and...
Yeah, so doing that...
That's easy.
That's very easy, and it's now available in Nigeria as well. So a capsule will be given, and you swallow it, and after some minutes, you'll breathe into a card, and that will be interpreted, and instantly you get the results to know whether you have it or you don't have it.
Wow.
So it's good to have that done, and of course, to actually confirm if you have ulcer, the best would be to do what we call a gastrointestinal endoscopy, the upper gastrointestinal endoscopy, and that is when a flexible tube with like a tiny camera at the tip is passed from the mouth through the esophagus into the stomach and the upper part of the intestine.
Is this painful?
It is a bit discomforting, but not painful.
Doctors, you've got to be careful when you talk about discomfort.
It's actually, some would choose to have it under, we usually give mild sedation and all, so it's not a painful
So let's
procedure.
go on a really short break. We'll be back. Let's take you on a short break. Stay with us. We'll be back in a minute.